Hello, everyone. Welcome to our first ever spinal cord injury educational series on enhancing patient safety. Our goal is to equip you with the knowledge to implement best practices in your unit. Today we'll be discussing Series Number 1. Rapid Recognition and Nursing Response to Autonomic Dysreflexia in Spinal Cord Injury Care. My name is Michael J. Orellano, your nurse educator, and I'm excited to share life-saving insights to help elevate your clinical response and protect our veterans from harm. So, let's begin. Introduction. Autonomic dysreflexia is a life-threatening medical emergency that every SCI nurse should be alert to. It occurs in individuals with spinal cord injuries at or above the T6 level. Autonomic dysreflexia happens when a noxious stimulus below the level of injury triggers an exaggerated sympathetic response, leading to dangerously high blood pressure. As bedside caregivers, SCI nurses are in the best position to recognize early warning signs, like a sudden headache, high blood pressure, sweating above the level of injury, or skin flushing. Immediate action can prevent serious complications, including seizures or stroke. Our goal today is to ensure every nurse on this unit understands the assessment, prevention, and emergency management of autonomic dysreflexia. Your expertise and rapid intervention are critical in keeping our veterans safe. Why do we need to understand autonomic dysreflexia and its impact? Autonomic dysreflexia occurs when something irritating below the level of injury, like a blocked catheter or full bowel, causes the body to overreact. Because the brain can't send calming signals past the injury site, the result is a spike in blood pressure. As SCI nurses, be on alert when patients complain of a sudden headache or discomfort. Check for flushing above the injury, sweating, and increased blood pressure. Our daily routines like catheter care, bowel programs, and skin checks help prevent these triggers. Most episodes start from things we can easily correct once identified. When we understand the physiology and triggers, we can catch autonomic dysreflexia fast and act early. This helps prevent strokes, seizures, and even death. Assessing autonomic dysreflexia. When a patient with T6 or higher SCI reports a headache or just seems off, check their blood pressure immediately. A sudden spike, typically 20 to 40 mmHg above their baseline, may indicate autonomic dysreflexia. Next, go through a quick checklist. When was the last bowel movement? Is their catheter draining properly? Are there any signs of a UTI or skin breakdown? Tight clothing, shoes, or wrinkled bedding can also be culprits. Most autonomic dysreflexia episodes are resolved by quickly identifying and removing the cause. As spinal cord injury nurses, you're the frontline defenders. Recognizing early warning signs and completing a thorough but quick bedside assessment can make all the difference. Here are the recommended prevention strategies. Preventing autonomic dysreflexia starts with the basics, our day-to-day nursing routines. Regular bladder scans, scheduled catheterizations, and bowel programs help prevent overdistension or constipation, the top autonomic dysreflexia triggers. Pressure injuries or skin irritations are also major contributors, so skin checks during bed baths or turning are crucial. We should also take a moment to educate veterans and caregivers about autonomic dysreflexia symptoms and when to call for help. Many patients can self-identify symptoms if they're aware. Use teachback to confirm understanding. If prevention becomes a routine part of our shift, we can dramatically lower the number of autonomic dysreflexia episodes. Prevention isn't complicated, it's smart nursing. Why management and emergency response is very crucial. If you suspect autonomic dysreflexia, act fast. First, sit the patient up to help reduce their blood pressure. Next, search for the cause. Is the catheter blocked? Are clothes or shoes too tight? Is patient constipated? Remove any noxious stimuli. If the BP stays high after these steps, notify the provider immediately and give prescribed medication, like nitroglycerin, if standing orders are in place. Keep checking vitals every 2-3 minutes until the crisis is resolved. Document everything in real time. Make sure the emergency autonomic dysreflexia protocol is nearby and easy to access. Remember, time is critical. Autonomic dysreflexia can escalate fast. Every SCI nurse must know this response by heart. Why it matters in our daily nursing practice? Every autonomic dysreflexia episode we prevent or resolve contributes to our patients' safety, dignity, and trust in care. These veterans rely on us to protect them from complications they often can't feel or describe. When we're educated, alert, and responsive, we reduce the risk of stroke, cardiac issues, or worse. Our SCI unit runs smoothly when nurses feel confident in recognizing and managing autonomic dysreflexia. Protocols help, but it's the nurse's skill at the bedside that makes the difference. Our team culture should empower every staff member, LVNs, RNs, and AS, to act quickly and work together to protect our veterans. This is what excellence in CI nursing looks like. So, here's our takeaways. Autonomic dysreflexia is not rare in our SCI population, but with strong nursing care, it's almost always preventable or easily managed. Quick recognition and action can mean the difference between life and death. This isn't just a clinical skill, it's a patient safety priority. Nurses are the eyes and ears of our unit, and your knowledge and vigilance are essential. Let's keep improving our practice, staying educated, and supporting each other. Our veterans depend on us, and we've got the training, the tools, and the teamwork to keep them safe. References. The following scholarly sources, published between 2020 and 2025, are formatted according to APA-TH edition guidelines and serve as the evidence-based foundation of this academic work. Utilizing current peer-reviewed literature ensures credibility, supports informed decision-making, and aligns with doctoral-level standards for scholarly rigor, relevance, and professional integrity. Thank you for your valuable time and attention. It is hoped that this presentation has made a meaningful impact on your professional practice. Please stay tuned for the next installment of the SCI Enhancing Patient Safety Educational Series, scheduled for next Wednesday. For any questions, please call me at phone 214-857-2787 or my extension number 72787. You can also email me at michael.orelanova.gov. I am looking forward to your continued participation and wishing you a productive and rewarding day ahead. Again, thank you very much.